Hello everyone, today I'd like to show you how to book patients on Aerona and how to manage a future appointment. So as a clinician, you will usually find your patient already booked in your diary, like in this case, where we have this test patient booked on the 14th of August at 10 o'clock. Now, if you click on the patient, you would see on the right-hand side, you have three options to choose from: unscheduled, future, and past. On the unscheduled appointment, you will see all the, which is now blank, you would see all the appointment that they are unscheduled for this patient, which is part of the treatment plan. And I'd like to show you how to treatment plan to book this appointment for the patient for treatment planning purposes. Future appointment, you will see all the appointments that have been booked for this patient, and in the past, you see all the appointment that this patient attended in our practices. Obviously, because this is a new patient, this is also blank. Now, let's see, for example, that you want to treatment plan this patient for a root canal and crown prep. How do we do that? First of all, we click on the patient, then we click here at the top of the screen where you see the treatment menu. Then what we do, we have plan one, and on the plan one, let's say we want to do a root canal treatment on the lower right six and crown. How do we do that? First, we select root canal, which is here. And then we select, you have three options: general, whitening, and root canal treatment. Here you have quite a few options. So let's say this is a complex root canal. You have to select complex RCT molar. And you have it here. Now here you have three stages: complex RCT molar, stage 1, pulp removal, stage 2, root cleaning, stage 3, root filling. So this relates to the all three stages of root canal, and you have to charge all three of them because this will be the way the patient will be charged according to the treatment. So you first select the first stage, which is £300, and you select the lower right six. And now you will see that you're creating a treatment plan in which lower right six has a complex molar first stage pulp removal root canal for £300. Then you go back again to root canal and you select the second stage, complex molar root canal. Stage number 2, root cleaning, and again you click on the lower right six. And then finally you do the same for the stage 3. You save it, and that's it. And now you have created a treatment plan for root canal for the lower right six. Then, if you also want to add a crown, you have to click on the crown treatment over here, select crown, select the crown you want. Let's go for full ceramic crown zirconia / Emax, save, and root canal. Now, for the purpose of treatment planning, for the invoice to give to the patient, that would be enough, because if you click here on treatment plan and then save or print, that's an appropriate treatment plan to give to the patient. But that's not it. You also have to prepare the appointment that the reception has to book for it. Remember, receptionists are not dentists, and they have to be told, they have to be asked what kind of treatment they have to book. They don't know about the length of the treatment or the appointment sequence. So what you do here, still in the treatment section, you go here on plan appointment, and you create the number of appointments you think you can complete the treatment. So, for example, for this case, I would personally complete the whole treatment in 3 appointments. Root canal treatment, crown preparation with a scan, and then crown fit. So you select 3 appointments to be created, and then the system will create 3 appointments, appointment 1, 2, and 3. Then you have to personalize these appointments accordingly. So you open the first appointment. This appointment is going to be for root canal. So you select root canal over here, and then you get the then the second things you do, you establish the length you need for root canal. This is a molar, let's go for 1 hour and a half. Then finally, here on the appointment info, you have to leave 2 notes, one for the reception and one for your dental nurse. So first you write reception and you ask them when you want this appointment to be booked. In this case, you want this appointment to be booked, for example, as soon as possible. So you write, please book ASAP. Then please make your life easy for your nurses, and also leave a note for the nurse and make them aware of the treatment you're planning to do. For example, you would like to ask your nurse to prepare for all 3 stages of root canal because you want to complete the whole treatment in one go. So you write down, please prepare for first, second, and third stage RCT plus composite build-up, for example. So they know exactly what they have to prepare for. If you save it now, you can see that your appointment has been saved according to your preference. Then appointment number 2 is going to be for crown prep. So you open it, you select crown preparation, you select the amount of time you think is best, and then again you leave a note for the reception and for your dental nurse. Reception, please book ASAP after appointment 1, and nurse, please prepare for crown prep. And this has been saved. Finally, for the third appointment, you open the third appointment. Again, you select crown and bridge. Usually for a crown fit, I would book for 30 minutes. And again, you leave a note for the reception. This time you have to allow the lab at least 2 weeks to make your crown. So please book 2 weeks after appointment 2. And then nurse, regular or conventional, you have to distinguish from implant crown fit. Okay, so now your appointment have been pre-booked. You can escort your patient to the reception, and you can see now if you click to unschedule, you have all your 3 appointments here. Yeah, if you click appointment number 1, you see that there is everything has been saved, the length of the treatment, the type of treatment, and your notes. So now all the receptionist has to do when the patient accepts the plan, either on the day or if they decided to accept it later over the phone, they only have to drag the appointment and book it accordingly. Okay? It is mandatory to pre-create this appointment because this will make life easier for both the receptionist, the nurses, and ourselves. Because what we don't want is to have for the reception to chase on clinician to ask them what kind of appointment they have to book, for how long, and which kind of appointment. So please ensure that you actually follow and apply this protocol to all new patient and treatment plan. Thank you for your time.